In last video, we discussed about hemoglobin and the different disorders of hemoglobin. In today's video, we are going to discuss about erythropoiesis, what are the factors which affect the erythropoiesis, and how the RBCs are destroyed. Hello students, I am Dr. Faisal and you are watching Bio-Ocean Classes. Let's get started. Erythropoiesis. The word erythropoiesis means formation of RBCs. So this is a process by which RBCs are formed in the body. Okay, RBC stands for red blood cells. If we see in mature individual, the RBCs, they are formed in the bone marrow. Bone marrow is a very important organ of our body which is involved in the synthesis of these RBCs. But when a baby is formed, RBC are formed in some other organs because bone marrow is not formed. When bone marrow is not formed in fetal life, first the RBCs, they are formed in the yolk sac. And when liver is formed, then RBCs, they are formed in the liver. And once the bone marrow it is formed, then the function of RBC formation, it's taken over by the bone marrow. So first RBCs are formed in yolk sac, then in the liver, and then in the bone marrow. Along with the liver, spleen and the cells of reticuloendothelial system, they are involved in the formation of RBCs. So in mature individuals, it is the bone marrow which is involved in the synthesis of RBCs. We have two kinds of bone marrow. One is red bone marrow, another is yellow bone marrow. Yellow bone marrow is not involved in the synthesis of RBCs because it contains fat. Red bone marrow is involved in the synthesis of bone marrow because it possesses some very important cells which are known as pluripotent hematopoietic stem cells. So bone marrow possesses stem cells which are able to form all the cells of the blood including our RBCs. Okay, so this red bone marrow, where it is located in our flat bones like pelvis, like ribs, like our sternum, and the ends of the long bones. These are the places where our RBCs, they are formed. Okay, so let's talk about adult RBC formation. How in adults RBC it is formed. In bone marrow, we have a cell that is pluripotent hematopoietic stem cell. So we have some stem cells, some cells in the bone marrow which has the ability to divide and form any cell of the body. हमारी बोन मैरो में कुछ ऐसे सेल्स हैं जो डिवाइड करके सारे ब्लड के सेल्स को बना सकते हैं. This pluripotent hematopoietic stem cell, it divides and forms two types of cells, myeloid stem cell and lymphoid stem cell. Okay, ये सेल डिवाइड करता है और माइलॉइड सेल्स और लिम्फॉइड सेल्स दो तरह के सेल्स बनाता है. द माइलॉइड सेल्स, दे डिवाइड एंड फॉर्म थ्री टाइप्स ऑफ सेल्स, 1, 2, 3. One colony forming unit of erythroblasts, second is colony forming unit of megakaryocyte, third is colony forming units for our granulocyte and monocytes. So सबसे पहले दिस स्टेम सेल हमारे पास है प्लूरीपोटेंट हेमाटोपोइटिक स्टेम सेल. ये दो तरह के सेल बनाता है, माइलॉइड सेल, लिम्फॉइड सेल. माइलॉइड सेल तीन तरह के सेल्स बनाता है जिनको हम कॉलोनी फॉर्मिंग यूनिट्स बोलते हैं, एरिथ्रोब्लास्ट, megakaryocyte and granulocyte, monocyte. Okay, so these are three broad divisions. Colony forming unit of erythroblast, it will divide and it's going to form the RBCs. ये divide करेगा और हमारे RBCs को form करेगा. Megakaryoblast, it's going to divide and it's going to form our platelets. And granulocyte, monocyte, it will divide into two types of cells, myeloblast and monoblast. Myeloblast, they will divide and will form our granulocytes, the WBCs, which are called as granulocytes, like neutrophils, eosinophils and basophils. And monoblast, they will result into the formation of monocytes and the macrophages. हमारे monocytes और macrophages वो monoblast cells से बनेंगे. And these lymphoblast or the lymphoid stem cells, they are going to give rise to T lymphocytes and the B lymphocytes. What is important here, I want to say, हमारे पास कुछ stem cells है. These stem cells, they will form myeloid and lymphoid cells. Myeloid will form three types of cells, erythroid cells, megakaryocyte cells, granulocyte cells and the monocyte cells. And lymphoid cells, they will form T lymphocytes and the B lymphocytes. Today we are focused only on the RBCs. I will focus on this portion. Erythroid series. We have myeloid cell, then erythroblast cell. This erythroid colony forming unit, it will form erythroblast. Erythroblast will form different set of blasts. Blast means immature cells. Then it's going to give rise to reticulocytes. Reticulocyte is the last immature cell. Last immature cell of RBC series which enters the circulation, and this reticulocyte, it will get converted into the RBCs. Okay, so this is related to the erythropoiesis process, how it operates in the bone marrow. Bone marrow is able to perform this process because bone marrow possesses this cell, pluripotent hematopoietic stem cell. What are these pluripotent cells? What are totipotent cells? I will cover in some different lecture. Okay, so now how the bone marrow starts the process of erythropoiesis. Which are the signals which bone marrow receives? First of all, whenever RBC production it decreases, whenever there are reduced RBCs in the blood, it's going to cause hypoxia. What is hypoxia? Hypoxia means tissue, it will get less oxygen. When tissue, it will get less oxygen, kidney will be stimulated. When RBCs are less, there will be less oxygen to carry, and this oxygen tension or oxygen stress, it will be applied to the kidney. And when kidney, it has less blood cells, when kidney has less oxygen, this kidney, it will secrete a substance that is known as erythropoietin. This is a very important molecule, erythropoietin. This erythropoietin, it will come out of the kidney, enter the blood, and via blood it will reach the bone marrow. When it reaches the bone marrow, it will stimulate the stem cells, and when stem cells, they are stimulated, what will happen? The RBC will be formed. When RBC will be formed, there will be increase in the RBC count. When RBC count, it will be decreased, hypoxia will be gone, and when hypoxia will be gone, the erythropoietin levels, it will come down. So we have a molecule that is known as erythropoietin. This erythropoietin molecule, this is the molecule which stimulates the bone marrow for production of erythropoiesis, and it comes from the peritubular interstitial cells of the kidney. The kidney, it has different types of cells, and peritubular cells are the cells which secrete this erythropoietin. Till now what we have discussed, erythropoiesis is the process of formation of RBCs, where it happens in the bone marrow. Why? Because bone marrow possesses stem cells. How stem cells are stimulated? Stem cells are stimulated with the help of erythropoietin. Where from this erythropoietin comes? It comes from the kidney. Okay, and why the kidney produces it? Kidney produces whenever kidney has oxygen tension. Whenever there is reduced oxygen to the kidney, kidney stimulates the peritubular cells to release the erythropoietin. Okay, I hope this is clear up till now. In case of chronic renal failure, or the patients whose kidneys are not working, the patient on the dialysis, they have very severe kind of anemia. You know why? Because their kidney is not able to produce erythropoietin. If their kidney is non-functional, they will not be able to produce erythropoietin. When erythropoietin is not produced, they are going to suffer from severe anemia. This was a question which was asked in previous year NEET. So remember this, whenever you have a kidney disease, the erythropoietin production is going to be low, and when erythropoietin production is low, you are going to suffer from the anemia. And you know what is anemia? A reduced level of hemoglobin in the blood. Okay, what are the factors which affect RBC formation or the erythropoiesis? Number one is the erythropoietin, as we discussed. Erythropoietin is a very important molecule. Second are some of the vitamins, like which are involved in the synthesis of hemoglobin. You require vitamin B12, folic acid, and vitamin C. These are the very important things which are required for erythropoiesis. Vitamin B12 and the folic acid are very important for maturation. What is maturation? Conversion of this blast cell to a mature cell. This is known as maturation. For this maturation, we require vitamin B12 and folic acid. We will discuss these things in detail subsequently. Some of the metals like iron, zinc, copper, they are very important in the process of erythropoiesis, because if you don't have iron, hemoglobin cannot be formed. When hemoglobin cannot be formed, erythropoiesis is incomplete. Similarly, zinc and copper, they are very important cofactor for different enzymes. That's why their deficiency leads to anemia. Some hormones like thyroid hormones and the androgens, if you have hypothyroidism or hyperthyroidism, your bone marrow, it's not going to perform its function well because BMR will be low, basal metabolic rate will be low. Similarly, the androgens, they have the stimulatory effect on the bone marrow. Okay, these are the factors on which the erythropoiesis depend. Now this is a very important question. What are the changes that happen during the formation of RBC? What does I mean by this? If we have immature RBC and I have a mature RBC, immature is known as blast and mature is known as RBC, red blood cell. Okay, erythroblast, erythrocyte, erythroblast and erythrocyte. What is the difference between these cells? As the RBC matures, what happens to the RBC? I will discuss it under 4 headings. What happens to the size of the RBC, what happens to the nucleus of the RBC, what happens to hemoglobin content, and what happens to the acidic character of the cytoplasm. Okay, let's discuss these things in detail one by one. If we talk about the size continuously decreases. Mature cell, it has larger size, and immature cell, it has a larger size, and mature cell, it has a smaller size. So this is first very important thing. The immature RBC, it has a larger size, and mature RBC, it has a smaller size. So as the RBC matures, size decreases. Nucleus is progressively removed. In immature RBC, the nucleus will be present, but as it matures, the nucleus is disintegrated, the nucleus is absent. So progressively the nucleus is lost. Okay, hemoglobin content, hemoglobin content progressively increases. There will be no hemoglobin, and slowly hemoglobin content will start to rise. And hemoglobin, it has basic nature, it has basic nature. Since here if we see hemoglobin will be less, there will be less basic character, and if we see the mature RBC, it has more of the hemoglobin, so more of the basic character. So acidic stain, if we see, it will take less acidic stain, and mature RBC, it will take more acidic stain. These are the 4 changes that happens during the maturation of RBC. The size decreases, nucleus is lost, hemoglobin content increases, and the acidic character of the cytoplasm, it continuously increases. Okay, if we talk about the lifespan of RBC, it is 120 days. After 120 days, the dead RBCs, the old RBCs, they are destroyed within the reticuloendothelial system. And very important organ of reticuloendothelial system is the spleen, because spleen possesses the narrowest capillaries of the blood, and via these capillaries the old RBCs are not able to squeeze, they are destroyed within the spleen. Okay, and what happens then we will discuss in the subsequent lecture. We have a very important cell that is known as reticulocyte. I already told you regarding this. The last immature cell is known as reticulocyte. After reticulocyte, I will be having mature RBC. So importance of knowing this reticulocyte is, if we want to know the functioning of bone marrow, we will calculate these reticulocytes. If the reticulocyte count, it is increased, means bone function is normal, bone marrow is functioning normally. And if the reticulocyte count, it is decreased, we say that bone marrow is not functioning. So to see whether bone marrow is functioning or not, we use this reticulocyte as an indicator. If reticulocyte count is high, means bone marrow is normal, it is functioning, and if the reticulocyte count is low, the bone marrow will be non-functioning. This was all about the, you can say, hemoglobin. It was all about erythropoiesis. In subsequent lecture, I will be discussing the disorders of RBCs. If you have any query, post it in the comment box, and if you like this video, kindly share with your friends, and don't forget to subscribe our channel. Thank you.